A consultant hemato-oncologist may recommend an allogenic stem cell transplantation for a patient who is suffering from diseases such as leukemia, where the bone marrow is invaded and infiltrated by leukemic cells or abnormal cancerous cells, or else in diseases such as the immune system of the body is malfunctioning, such as in severe immunodeficiency syndromes, and also in certain hemoglobin dysfunction disorders such as thalassemias and sickle cell anemia, as well as in certain disorders where the bone marrow malfunctions such as aplastic anemia. So what happens in this treatment is that the patient gets stem cells from a person who is a good genetic match. We specifically look for 10 specific genes which should match between the patient and the donor. Sometimes the patient's brother or sister can be a good genetic match. However, this happens only in 25% of the time. If there's no family member who is a good genetic match, we have to look for someone unrelated but has similar genes. How do we find such people? That's where the stem cell donor registry comes in. This registry is like a large database of relevant genetic information from people who are willing to and also who fulfill the criteria to donate stem cells to people who need them if they match with these patients. When a patient needs stem cells, we can quickly search this database to find a potential stem cell donor. The larger the number of people who are contributing to this registry, the higher the chances of our patients finding a genetic match. Unfortunately, our country did not have such a bone marrow registry so far, which would have immensely helped our patients who require an allogenic stem cell transplantation who are suffering from grave diseases such as leukemia. Most of the countries run their own registries and different organizations on the registries, and different countries in the world have amalgamated these registries to run for certain regions of the world. So what happens at present is that for those patients who do not find a genetic match within their families, we have to send their genetic information to other countries where there's a bone marrow registry to find a potential match. And if they find a potential match, we have to obtain their stem cells from these donors, and they have to be transported back to Sri Lanka for our patients. This is a costly procedure. And sometimes the patients themselves have to travel across borders to obtain these treatments, which are exorbitantly expensive. If we combine our Sri Lanka stem cell donor registry with those around the world, it enhances the chances of finding a potential match for those Sri Lankans who are living around the world and also for people from other countries. Sri Lankans are very well known for their generosity. I want to invite all of you to join in to make this national effort a success. If you are willing to donate your stem cells and if you are eligible to donate your stem cells, please register yourselves in the Sri Lanka Stem Cell Donor Registry.